Microcephaly or small head. By the end of the lesson, you should be able to diagnose an infant or child with microcephaly, list investigations for a case with microcephaly. What's microcephaly? It is an occipitofrontal circumference more than 2 standard deviations below the mean for age, sex, and gestation, or below the third percentile on the percentile curve. We can classify microcephaly according to the age of onset into congenital, means presence of microcephaly at birth or by 36 weeks of gestation, or postnatal, usually it is acquired, its failure to normal growth in a brain that was of normal size at birth. Another classification of microcephaly is by the presence of associations or not. Isolated or pure is not associated with any other anomalies. Syndromal or complex is associated with one or more additional anomalies in the skeleton of the heart or other anomalies. Etiologic classification into primary or genetic microcephaly. This could be familial, either autosomal dominant or recessive, or syndromes as Down syndrome, trisomy 21, or Edwards syndrome, trisomy 18. This is chromosomal abnormalities. Secondary or non-genetic microcephaly due to exposure to radiation during the first trimester. Congenital infections as congenital CMV, toxoplasma, and rubella as a part of torch infection. Exposure to drugs as fetal alcohol syndrome and metabolic as maternal diabetes and phenylketonuria. Post-meningitic and post-encephalitic sequelae can lead to microcephaly. How can you evaluate a case of microcephaly? In familial, microcephaly needs exclusion. You need detailed history taking and prenatal history, birth asphyxia, or any cause of brain damage at birth or postnatal. Measuring the occipitofrontal circumference of the siblings and parents should be recorded, especially in familial cases. Examine for associated dysmorphism, assess the development, motor and mental, and do detailed neurological evaluation and look for seizures and spasticity. What investigations to be done in a case of microcephaly? An X-ray or CT skull bones to determine the suture patency, overriding, fusion, and calcification of the skull. MRI in cases of familial microcephaly and suspected migrational disorders or abnormal brain. Torch serology, karyotype if dysmorphism is suspected, and metabolic screening for potentially treatable causes as phenylketonuria. The treatment of microcephaly is usually supportive. Treatable metabolic diseases as phenylketonuria can be treated by phenyl pre-diet or for PICU. Treatment of seizure, special schools if there is mental retardation, and genetic counseling.